prostate carcinoma. Prostate is a gland of the size of walnut located below the urinary bladder adjacent to the rectum. It produces a secretion called as prostate secretion, which become part of the semen, and it also activate the movement and the capacity and ability of the germ cell, that is the sperms. Now the cancer of the prostate is usually appears at the age of 50 later on. Occasionally it is before this age limit. Of course, it is exclusively it is a male disease, because this endocrine or the gland is located around the urethra of the first part of the urethra. So it produces compression, obstruction and stricture in the urethra if it is enlarged due to innocent inflammation, which is called as benign prostatic hyperplasia, or due to tumor, that is which is due to the production of the overgrowth of the cancer cells in the prostate. So it is due to mutation, abnormality in the function of the DNA of the prostate when it occurs, that multiply, replicate aimlessly, blindlessly, with excessive speed, and ends in the form of tumors. And those tumors produces pressure, narrowing of the urethra, and produces various complications of micturition. So it is due to abnormal changes in the DNA of the prostate cells, or overall in any cancer where it is located, there is disorganization, distortion of the function of the normal DNA in that organ. So this is a pathophysiology. Now there is also family history of the prostate cancer. There is familial predilections, predisposition of the disease. So there are certain genes, abnormal genes, which produces this prostate carcinoma in certain families. Mostly it is in excessive ratio in black race in the world. So this is a tumor of the prostate, and it produces obstruction in micturition. It produces pain, low back pain, dysuria, that is pain during micturition, incontinence in micturition, that is dribbling of the urine. There is slow stream of the urination. In advanced cases, when it spread to the distant organs through the lymphatic channels and the blood stream, and that produces hematuria, that is blood passing in the urine. This is mostly and mainly diagnostic and clinical feature of the prostate cancer. Similarly, because this gland is a part of reproductive system, so there is also blood in the semen, because semen is formed along with the sperms and the secretion of the prostate glands, which passes through the urethra to the exterior. So these are the main factors: age factor, familial predisposition, abnormality in the DNA cells of the prostate glands, and there is also certain risk factors, that is excessive drinking, smoking, diabetes mellitus, obesity, hypertension. These factors also contribute to the production of the prostate carcinoma.